feel your eyes, they all over me. Don't be shy, take control of me. Get the vibe, it's gonna be lit tonight.
Baby girl, you give me 10 ton of fatness, give me some of that. Thinks with the badness, look how she at. Shape like a death, but I'm not just that. It's a good piece of mental under the cap. A piece of game, I'm love how you chat. Watching every step of the pepper, the way you got. Staying in my brain, memory not detached. Mainly my aim is to give it this love. If not, dig the way you move. Let me acknowledge the way you do. Then I would not lie, baby, you. Baby, I'm like addict. It's how hypnotic the way you move. That's why I wanted to get to you. And I would not like a baby you. Moves how hypnotic.
No lie,
Girl, you never meant to.
feel your eyes, they all over me. Don't be shy, take control of me. Get the vibe, it's gonna be lit tonight.
Girl, you never meant.
No lie, hypnotized, pull another one. It's alright, I know what you want. It's the vibe, it's gonna be lit tonight.
Girl, you never
No
meant.
lie.
Surgery in progress.
They wish and they wish and they wish and they wish and they wishing on me. Yeah. I don't wanna die for them to miss me. Yes, I see the things that they wishing on me. Hope I got some brothers that outlive me. They gon' tell the story was different with me. God's plan, God's plan. I hold back sometimes I won't. Yeah. I feel good sometimes I don't. Hey, no. I finesse down Western Road. Hey, next. Might go down to G.O.D. Yeah, wait. I go hard on Southside G. Yeah, wait. I make sure that Northside eat. And still, bad things. It's a lot of bad things that they wish and they wish and they wish and they wish and they wishing on me.
A 55-year-old male, Mr. John, is in the surgical ward, 6 hours post-appendectomy. He is lying in bed, guarding his abdomen, and appears restless. When the nurse assesses him, he says, "My stomach hurts so much. It's a 7 out of 10 on the pain scale." He is hesitant to move or cough. His vital signs are BP 140/90 mmHg, HR 105 BPM, RR 22 BPM, and temp 37.2 degrees Celsius.
Appendicitis happen when the appendix, which is a small pouch like part of the body connected to the large intestine, becomes inflamed. The appendix exact job is clear, but it can get swollen if something blocks it, like stool, foreign object, or an infection.
Etiology appendicitis. The cause of appendicitis is abrasion of the appendiceal lamella by an appendiceal tumor, submucosal lymphoid follicle hyperplasia. Vesalid are a histolytic parasite. Various factors play a role as senior factor, but abrasion of the appendiceal.
The pathophysiology of appendicitis starts with inflammation and swelling because the appendix becomes twisted or blocked, which can be caused by fecal matter, a tumor, or a foreign object, according to the surgical staff section of the Faculty of Medicine, University Indonesia. The pathophysiology of appendicitis begins with a blockage in the lumen. The appendicitic stop becomes blocked because the lining tissue swells and narrows the top.
Basically, abdominal pain It's the first symptom of appendicitis and usually occurs in the periumbilical area. Approximately 50% to 60% of patients with appendicitis who present with periumbilical pain report migration of pain to the right lower quadrant within 24 hours. Approximately 80% to 85% of patients report anorexia after the onset of abdominal pain, and 40% to 60% report nausea with or without emesis. Common signs include fever, McBurney sign, tenderness at the point 1, to the distance from the right anterior superior iliac spine to the umbilicus, sensitivity 50% until 94%, specificity 75% until 86%. Robsing signs: right lower quadrant tenderness with palpation of the left lower quadrant, sensitivity 22% until 68%, specificity 58% until 96%. Right lower quadrant abdominal tenderness with passive right hip extension, sensitivity 13% until 42%, specificity 79% until 97%. And obturator side, right lower quadrant tenderness with flexion of the right hip and knee, followed by inferior rotation of the right hip, sensitivity 8%, specificity 94%.
Complications of appendicitis are divided into 3 parts. The first is appendiceal abscess, a collection of pus in the appendix forming a mass in the right lower abdomen, treated with antibiotic and appendectomy. The second is perforation, rupture of the appendix that allows bacteria to spread into the abdominal cavity and cause serious infection, requires immediate treatment. And the third is peritonitis, inflammation of the peritoneum due to spread of infection in the abdominal cavity, causing severe abdominal pain, fever, and vomiting, requires hospitalization.
To prevent appendicitis, it is important to keep the digestive system healthy by following a healthy lifestyle. One thing you can do is eat more foods that have fiber, like fruit and veggies, because fibers help your body digest food better and stop you from getting constipated. Constipation can lead to a buildup of weight in the intestine, which might block the opening of the appendix and could cause it to become inflamed. It's also important to drink enough water to help the digestive system work properly and keep stools soft so they don't get too hard. Other ways to prevent illness include eating in a healthy and regular way and making sure the food you eat is clean to stop harmful bacteria or germs from getting into your body, causing infection in your stomach or intestine. By following these healthy lifestyle habits, the chance of developing digestive system problems like appendicitis is likely to be reduced.
Scene 1. Post-operative patient condition. A 55-year-old male patient is in the surgical ward 6 hours after undergoing an appendectomy. The patient is lying in bed while holding his abdomen. His facial expression appears tense, and he looks slightly restless because he is still experiencing pain around the surgical wound. This condition commonly occurs in post-operative patients due to tissue trauma caused by the surgical procedure. Therefore, nurses play an important role in providing nursing care interventions aimed at reducing pain, preventing infection, and supporting the patient's recovery process. Nurse 1 and Nurse 2 enter the patient's room.
Good morning, sir. We are the nurses who will assist in taking care of you after your surgery. Sir, I'm Nurse Vivi Listia Radjak. You can call me Vivi, and this is my partner.
My name is Nur Fadilah Pakaya, and you can call me.
Morning, nurse. My stomach still hurts a lot.
Alright, sir, we will help reduce the pain you are feeling and make sure your condition remains stable during the recovery process.
Scene 2. Non-pharmacological pain management. Pain is one of the most common complaints experienced by patients after surgery. Therefore, nurses can perform various interventions to help reduce the patient's pain. In addition to medication, non-pharmacological methods such as relaxation techniques and proper body positioning can help decrease the perception of pain. In this stage, the nurses teach the patient deep breathing exercises to help him relax and improve oxygenation.
Sir, to help reduce the pain, we will get you to a deep breathing exercise.
Alright.
Please inhale slowly through your nose and exhale slowly through your mouth.
Tarik nafas, tahan, hembuskan.
Lagi.
Tarik, hembuskan. Kasih nama, tarik, hembuskan. Tarik lagi, hembuskan. Try to do it slowly and repeat it several times so your body becomes more relaxed.
Alright. Okay, I will try again.
The breathing exercise can help reduce muscle tension and lower the intensity of pain.
Now we will help adjust your position so you can feel more comfortable.
This semi-sitting position can help reduce pressure in the cervical wall.
Yes, it's feel little better now.
Scene 3. Collaboration in analgesic administration. In addition to non-pharmacological interventions, post-operative pain management also requires pharmacological therapy through the administration of analgesic medication. Medication is given according to the doctor's prescription and through collaboration between doctors and nurses. Analgesics aim to relieve pain so that the patient can rest comfortably and the healing process can occur more effectively. The surgeon and anesthesiologist enter the room.
Good morning, doctor. It's time to the visit of the patient after appendectomy.
Alright, good. Thank you. Good morning, sir. I'm Dr. Nur, as a surgeon, and this is my partner.
I am a doctor anesthesiology, Dr. Nabila.
So, nurse, how is the patient condition?
The patient is still complaining of pain around the cervical wall.
Alright, to control post-operative pain, the patient will receive analgesic medication.
Nurse, please prepare the medication according to the medical instruction.
Yes, doctor. Sir, we are going to give you medication to help reduce your pain. Sir, this is your medicine.
Thank you.
Sir, the medicine is taken after eating, then taken twice a day. This medication will help control the pain so you can feel more comfortable during your recovery.
Alright.
We will take our leave, sir.
Get well soon, sir.
Thank you, doctor.
Thank you, doctor.
Thank you, nurse.
Scene for infection prevention. Post-operative patients have a high risk of developing infection in the surgical wound. Therefore, healthcare professionals must always apply infection prevention principles when performing nursing procedures. One of the most important steps is proper hand hygiene before and after patient contact. Hand hygiene helps prevent the transmission of microorganisms that may cause infection in the surgical wound. Nurse 3 enters carrying wound care equipment.
Nurse, I was preparing all of the equipment for wound care for the patient.
Okay, good. Before performing the procedure, we must performing hand hygiene. Okay, you can do it like this.
Enwashing is performed to prevent the spread of microorganisms that may cause infection.
After showing a hand hygiene, we can continue to wound care the patient.
Scene 5. Surgical wound care. Wound care is an important nursing intervention for post-operative patients. The purpose of wound care is to maintain cleanliness of the wound area, prevent infection, and promote faster tissue healing. Nurses also need to observe the wound condition carefully to identify any signs of infection, such as redness, swelling, increased warmth, or abnormal discharge from the wound.
We will now check your cervical wall.
There are no signs of redness or swelling.
The wound appears clean and in good condition.
Sir, now we will change the wound dressing to keep it clean, yeah?
The wound dressing need to be changed regularly to keep the wound dry and protect.
Can I touch the wound?
It is better not to touch it, sir, because it may increase the risk of the infection.
Scene 6. Early mobilization. Early mobilization is an important intervention for postoperative patients. Mobilization helps improve blood circulation, prevents muscle stiffness, and accelerates the patient's recovery process. Mobilization should be performed gradually according to the patient's condition, starting from sitting on the edge of the bed to standing and walking slowly with assistance from the nurses.
Sir, now we will help you perform gradual mobilization.
I am still a little afraid to move because it's hard.
That is okay, sir. We will assist you slowly.
Please sit slowly on the edge of the bed.
All right.
Permission, sir.
Mobilization help improve blood circulation and speed up the recovery process after surgery.
If your condition improves, later you may start standing and walking slowly.
Scene 7. Patient education. Health education is an essential part of nursing interventions for postoperative patients. Through education, patients can understand the necessary steps they need to take during the recovery period to prevent complications and support faster healing. The education provided includes wound care, gradual mobilization, and pain management after surgery.
Good morning, sir.
How are you today? Sir, there are several things you need to pay attention to during your recovery.
First, keep the surgical wound clean to prevent infection.
Second, practice deep breathing exercise regularly to help your body relax.
Third, perform gradual mobilization according to your ability.
If all these instructions are followed properly, the healing process will be faster.
If the pain increases or if you experience other complaints, please report them to the healthcare staff immediately.
We will continue to monitor your condition during your recovery.
Sir, don't forget cleaning your medicine. And don't forget to always control your wounds.
For the last, taking care of yourself, sir.
Thank you, nurse.
We will take all leave, sir. Thank you.
Thank you,
Thank you.
doctor.
Thank you, sir.
In conclusion, post-operative care for appendicitis patients requires a comprehensive and continuous approach. Nursing interventions such as pain management, infection prevention, and wound care play a crucial role in ensuring the patient's safety and comfort during the recovery period. In addition, early mobilization and proper positioning help improve blood circulation, reduce complications, and accelerate the healing process. These actions support the patient in gradually regaining physical strength and returning to normal body functions. Patient education is also an essential part of care. By understanding how to manage pain, care for the surgical wound, and recognize warning signs, patients can actively participate in their own recovery and prevent further complications. Finally, effective collaboration between nurses and doctors ensures that all interventions are carried out appropriately and safely. Through this holistic approach, patients are expected to recover well, regain independence, and return to their daily activities with improved health and quality of life.
Fourth semester nursing student. Tired, stressed, and overwhelmed with assignment, practice, and sleep night. Sometimes we complain. Sometimes we feel like giving up. But we keep going because the struggle is part of the journey to become the nurses we dream to be.